Today, we will be discussing psychological health in the occupational therapy workplace at the organizational and policy levels. The Psychological Health and Safety in the Workplace Prevention, Promotion, and Guidance to Stage Implementation document by the CSA is a framework intended to promote and guide psychological health and safety for employees in the workplace environment. We will primarily be using this document to discuss psychological health in the OT workplace at the organizational and policy levels. The preparation of the document was completed by the CSA group in collaboration with the BNQ. The framework is sponsored by the Mental Health Commission of Canada and funded by the Government of Canada, Bell Canada, and Great Westlife Centre for Mental Health in the Workplace. Why are organizational and policy level standards important to the occupational therapist? Studies show that organizations that employ psychological health and safety strategies perform better overall on fundamental performance categories, such as shareholder returns and human resources measures. Furthermore, factors such as lack of resources and lack of time were found to be some of the primary sources of negative psychological health. Such factors are organizationally dependent, which means that organizational level changes can play an integral role to mitigate psychological stressors in the workplace. The framework outlined by the CSA to prevent, reduce, and address psychological health in the OT workplace is referred to as the Psychological Health and Safety Management System, or PHSMS. It focuses on 5 main elements: commitment, leadership, and participation, planning, implementation, evaluation and corrective action, and management review. I will discuss them in detail in the following slides. Many different ways to implement the model depending on factors such as company size, geographical scope, available resources, and organizational readiness. In this component of the system, roles and responsibilities are clearly communicated. Commitment entails the organization creating or incorporating a policy statement that commits the organization to systematically addressing psychological health and safety in the workplace. It also ensures accountability at all levels within the organization. For individuals who undertake a leadership role, it is important that they set goals and lead and influence positive culture. They should always involve other employees in understanding the importance of psychological health and safety in the workplace, provide system feedback, and identify psychological health and safety opportunities. Participation is a requirement for policy success. It is reinforced through understanding the needs and goals of stakeholders and workers, and involving workers in evaluation through follow-up of actions resulting from evaluation. Organization identifies and prioritizes psychological health and safety vulnerabilities, such as hazards, risks, and management system gaps. Specifically, it comprises plans for psychological health and safety management, documentation and establishment of plans to achieve psychological health and safety objectives and targets, and studies of health and financial impact. It focuses on developing a consistent vision of psychological wellness in the workplace, and emphasizes the need for organizational policies that promote psychological health. It's not just about preventing and reducing risks and hazards. In the implementation standard, infrastructure and resources of the psychological health and safety system are to be provided by the organization. It includes resources such as knowledge, abilities to incorporate psychological health and safety into various systems, and authority. Organizational level preventative and protective processes shall be in place to resolve the work-related hazards and risks. Education, awareness, and communication. All 3 provide psychological health and safety information on how to reduce hazards and risks. Competence and training of those in leadership roles is key in promoting psychological health and safety, as reports show that employees identified management's competence at building interpersonal relationships as a priority in the workplace. The organization maintains protocol to monitor and measure how well they adhere to psychological and safety standards. Similar to monitoring and measuring, internal audits should be maintained and performed regularly to determine the efficacy of the PHSMS, as well as organizational adherence to psychological health and safety standards. In this dimension, The organization shall also address issues of non-conformance to PHSMS as well as resolution problems of hazards and risks. Lastly, the framework undergoes management review and improvement. Organization conducts regular management reviews of the PHSMS, which includes audit results, evaluation or outcome data, assessment of adherence of PHSMS to standard. The outcome is then summarized, and organizations review areas of improvement and implement necessary corrective actions, update organizational policies and procedures relevant to the PHSMS, and communicate to workers and management the outcomes.